I'm going to give you the answer to every single nursing exam question you are ever going to get in school. Because the truth is, you are in nursing school for one reason and one reason only. And until you understand this one reason, you're going to keep studying the wrong way, stressing yourself out, and wondering why your test grades won't improve. And I'm sorry if it's hard to hear this. But one thing I can tell you you are not in nursing school to do is to memorize every fact on your PowerPoint slides. In fact, even though you kind of know that you're not supposed to be memorizing all this stuff, let's be honest, somewhere deep in the back of your mind, you're still kind of thinking, if I could just find a better study guide, a better Quizlet, then I'd finally do better on my nursing exams. But even when you find new study guides and Quizlets, what happens on test day? You read the questions and you quickly realize they're not testing you on anything you studied. Instead, they're asking you to prioritize nursing actions and identify the most concerning symptoms. And once again, you end up second-guessing yourself, switching your answers, and getting things wrong that you should have gotten right. It feels like the exam is full of trick questions, and you always walk out thinking, I studied so hard and sacrificed so much. What am I doing wrong? The bad news is that negative cycle will continue to happen so long as you're focusing on the wrong nursing school goal. The good news is that I'm telling you what that goal is right now, because the entire point of nursing school hinges on this one thing. It's to teach you how to think like a nurse. That's what NCLEX tests you on. It's what all the standardized exams like HESI, ATI, and Elsevier test you on. So it's what every single classroom exam is going to test you on as well. How to think like a safe, effective beginning nurse. And I know that sounds like an abstract concept, and you're probably asking me, but how do I do that, Nicole? And because you don't know yet, and because nobody's been able to show you how to work on that abstract skill yet, you tend to default to things like memorizing lab values, memorizing drug names and side effects, memorizing nursing actions and random symptoms all day long. But you and I both know that memorization is not going to save you in nursing school, and it's not going to save you in real life practice either. Because when you finally graduate and get your first nursing job, nobody's going to care if you knew that fact on the caption of page 329 of your textbook. What they're going to care about is, can you use that information from the caption on page 329 in your textbook to think through a patient situation and prioritize what to do and why you're doing it. And it's that skill that every nursing exam is designed to test you on. Despite what your nursing instructors sometimes tell you, they actually don't care if you can regurgitate the information as much as they care about if you can critically think and have good clinical judgment about that information. Because think about it like this. When you get a question that says that the patient has shortness of breath, low O2 sats, and is feeling anxious, what's your priority? You're never going to find that exact answer in your nursing textbook. But if you're able to think through some of the things that that textbook teaches you, then you'll be able to think through the question and come to the best answer. So from now on, every time you sit down to study and you start to feel overwhelmed by the sheer amount of information, stop and remind yourself of this. You're here to learn to think like a nurse, and you have to learn to study like a nurse in order to do that. When your studying starts with a focus on the thinking part, then you'll start recognizing what test questions are actually asking on you, and you'll stop second guessing. That translates into finally getting comfortably passing grades because you're learning to think like a nurse and doing it all without getting burnt out. If you want a step-by-step study framework that turns this abstract concept into something concrete that automatically trains your brain to think like a nurse, comment with SBSS, and I will send you my free Silver Bullet Study System training overview for free.